A legacy of service excellence reaching far and wide, committed to caring since 1961. Our state-of-the-art facility was built from the ground up, with our grand opening held in May 2007. Our first patient received treatment at the new facility in June 2007. For over 55 years, Hartgrove Behavioral Health System has been at the center of the community. Our well-established roots ensure that everyone has an opportunity to access mental health services. Our dedication to further growing and strengthening community-specific wellness and health services is shown through service excellence, our ongoing partnerships, and 24-hour services. Our commitment to the community fosters strong relationships and allows us to continue to meet and exceed expectations. There is no way in which to quantitatively measure the success of our program, as the program's progress cannot solely be based on numbers or revenue. We measure the program's success by how well it fits Hartgrove Behavioral Health System's mission statement. Our objective is to make quality health services accessible, affordable, and available to the populace through responsive community health outreach. Hartgrove Hospital's community outreach program is based on our dedication to provide our community access to excellent care and our commitment to becoming the healthcare provider of choice for residents of Chicago and beyond. Our philosophy centers on the belief that when problems exist in the community, the solutions do as well.
We really try and treat people that like we would want our own family to be treated. So it's comforting for me to know that our partnership with Hartgrove Hospital, they will go above and beyond, and I know that they're treating people like they would want to be treated.
With each obstacle that we ran into, we were able to work with the hospital, and Hartgrove was amazing with regards to being flexible and saying, well, let's try this, or we're willing to try this. And anything that we came up with, they were always a part of the solution team, and they were always accessible and flexible.
So that really led us to this partnership in a way that we saw our students would be having their mental health needs met, as well as being able to stay connected to instruction as much as possible by bringing the services into the school.
This has filled a huge need for our children and their families. Hartgrove is offering group, individual, and family therapy for us, so it's really exciting.
The work that Hartgrove does mitigates the conditions out here on the street that often leads to this unpredictable violence throughout the community. So thank you. It makes a difference in the lives of the members of the Chicago Police Department and the cities of Chicago. Thank you very much, Hartgrove.
The Outpatient Services Department at Hartgrove Behavioral Health System has provided decades of service to our community and partners. Our first location, Austin Family Counseling Center, provided nearly 80,000 patient visits, and we've grown significantly since 2014. Our location on the south side of Chicago, Chatham Family Counseling Center, opened in September of 2014 and has provided nearly 30,000 patient visits since that time. Beginning in the winter of 2017, our Outpatient Services Department began partnering with various school districts in the Chicagoland area. Our first partnership with Community High School District 218 allowed our services to be rolled out into 4 different schools in the Chicagoland area. In October of 2017, we also moved into our largest clinic-based location. Since our relocation there, we have provided nearly 20,000 patient visits at the Oak Park location. Hartgrove Behavioral Health System's commitment to service excellence goes beyond providing patient care. We are also committed to being the largest training site for behavioral health providers in the state of Illinois. Through community outreach, Hartgrove has established meaningful partnerships with social service agencies, law enforcement, judicial systems, faith communities, educational institutions, legislative and appointed officials, and other groups to promote wellness and a healthier lifestyle for all community residents. We believe that success of our community outreach is measured by the successful outcomes we have.